Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really, like Simply Nature, that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Hello po, ako nga po pala si Ronaldine Rosales Batalier, 23 years old at ako po ay taga Bicol, Albay. Na-diagnose po ako nung taong 2015, which is ito po yung mixed germ cell tumor sa ovary. Stage 1 po ako nung diagnose ako. Tinanggal po agad yung right ovary ko noon. May nakakita sa akin na taga doon sa amin, sabi niya, what if try ko daw sumali ng contest? Tapos hindi ko nga sinabi na may sakit ako. Sabi ko, sige baka sakaling kahit paano may pandagdag kami sa gastos namin. Then noong 2017 po, yun na po, pabalik-balik yung lagnat ko. Siguro mga 2 weeks hindi ako nawawalan ng lagnat. Tapos yun na, pagpa-check up ko kasi lumaki po yung tiyan ko. Doon ko po nalaman na yung cancer ko daw, numerous to count na siya. Yung sakit sobra pa, yung nararamdaman ko, likod and sa stomach ko. Ganun po lumaki po yung tiyan ko, hirap na hirap po ako. Nagawa po yung nakalatan na din yung lungs ko. Yung sa liver ko, kaya daw po lumaki yung tiyan ko, gawa ng sa liver po. Hindi na masyado nagpa-function yung mga organ ko sa loob ng tiyan. Yun po, ni-repair na po kami sa child house. And then, nung start na nag-chemo ako, doon na po kami tumira. Nag-stay na po sa child house. Akala ko okay na, hindi na, wala na mangyayaring operasyon ulit. Pero nagulat po ako kasi every monthly check-up na lang po ako. Umuwi lang po ako sa amin tapos nagsusuka na naman ako. Akala ko kung ano na naman po yun. Yung dumi na ilalabas ko sa bibig na. Sabi ko, ano na naman to pa? Kaya na naman tayong sisimula na naman tayo. May nakita daw po ulit na bukol sa diaphragm. Iyak na naman po ako. Sabi ko, hindi pa nga magaling yung sa ibang organ ko. Tapos ito na naman. Po as of now, wala na po akong treatment and may tumor pa po ako sa diaphragm. And lately, may nakita na naman daw po sa akin ng gallstone sa may gallbladder ko. Napansin ko po talaga, start po uminom ako nung Simply Nature, which is yung powder and tablet po na PPARs. Para pong, pag nainom ko na po siya before ako matulog, pag nakakainom po ako, parang nare-relieve, parang nare-relax po yung katawan ko. Siguro mga 2 days after na take ko po yung gamot, parang napansin ko na parang everyday na ako nagbabawas. Kasi po talaga dati, siguro sa isang linggo, 3 beses lang po ako nagbabawas. And nakita ko po talaga yung good feedback agad ng gamot na ininom ko. Kasi yun nga po, parang pag nainom ko po siya, parang yung sa loob ko na may something ako naririnig na tumutunog. And after yun po, nagbabawas na po ako. And parang ang gaan po sa pakiramdam. And parang medyo po nabawasan yung bloated ko sa tiyan. Start po nung uminom po ako. About po dito sa PPARs powder po, tinitake ko po siya every after meal. And based sa protocol po na ibigay po sa akin ni Doc Jansen, pag morning, which is 5 scoop, nilalagay po sa ilalim ng dila, and antayin mo po yun matunaw. Pag gabi naman po, tinitake ko siya after dinner, which is 4 scoop naman po siya. Kasi sa protocol po is kailangan everyday makatake ako ng 9 scoop. So, kapag po, based po sa observation ko, kapag po naiinom ko po itong PPARs powder,
Parang yung something na tumutunog po talaga sa tiyan ko na parang may something, parang kini-cleanse na yung sa loob ng tiyan ko. And after po nun, magbabawas na ako. So parang after ko pong magbawas nun, parang feeling ko sobrang gaan ng pakaramdam ko sa tiyan ko. Tungkol naman po sa PPARS Plus tablets naman po, based sa protocol po na ibinigay po sa akin ni Doc Jansen, ano po siya, kailangan everyday makatake po ako ng 30 tablets. So sa protocol po na sinusunod ko, iinumin ko po siya with empty yung stomach ko. Pag morning, pagkagising ko, ito po talaga agad yung iniinom ko. 15 tablets sa morning, and after naman po, same, kailangan empty din yung stomach mo. 15 sa morning, ng pagkagising ko, and 15 sa evening after dinner ko before ako mag-sleep. Kasi yun nga po, mas pinipili ko siya after dinner na lang po siya inumin para po agad, pag nainom ko po siya, yun nga po, nare-relieve yung katawan ko, parang mabilis po ako nakakatulog, and naiiwasan ko po yung insomnia na lagi ko pong nararanasan noon po, lalong-lalo na po nung after po ako mag-chemo. So yun. Daily routine ko, yun, gumigising ako ng umaga for exercise kasi yun din yung advice sa akin ng doktor ko. Kailangan may regular exercise ako and pagkain ng mga masustansyang pagkain. And yun nga po, nabanggit ko last time na mahilig talaga ako magluto. Yun po talaga, kapag kumakain po kami sa office, talagang ako po yung luluto po para sa pagkain po namin ng ibang mga kasamahan po pasyente. As of now, thankful po ako kasi isa po ako sa nakatanggap ng scholarship sa isang magandang universidad dito sa Manila. Isa po sa nag-udyok sa akin para kumuha ako ng kursong education is yung mga bata po na kasamahan ko dito. So, nakikita ko po yung hirap ng papa ko. So, sinasabi ko sa sarili ko na hindi ako kailangan panghinaan ng loob. Kasi yung papa ko, nilalaban niya ako eh. Pero ako that time po kasi kapag naiisip ko yung taning ko, parang ang sakit po. Like, nakikita ko yung papa ko na lumalaban. Pero yung katawan ko, pakiramdam ko po kasi sumusuko na kahit yung utak ko, yung puso ko gusto ko lumaban. Hindi matutumbasan ng pasasalamat yung nagawa sa akin ng papa ko kasi talaga sobrang bait ng papa ko.
And nung November po is nag-CT scan po ako. Doon ko po nalaman na may nakita daw po na bagong tumor po sa akin. So that time, syempre, naisip ko na okay na ako tapos may nakita na naman po ulit na bago. So I am so thankful po kasi nung December po is nakilala ko po kayo. Nakilala ko po sila Mr. Shyan, sila Doc Jansen po at ang Simply Nature staff po na alam ko pong nakatulong po talaga sa akin. And yun nga po, nung nakita po na parang bad yung result ng CT scan ko, and after po ng December, bali po after December po, and until June, July, bali nakatatlong CT scan po ako. At nakita ko po talaga yung improvement po ng result ng CT scan and ultrasound ko po. And I'm so happy po na nitong latest na CT scan ko nung July, tuwang-tuwa po si Doc Jansen kasi talagang nakita po niya na lumiit po talaga yung tumor ko. And masayang-masaya po ako doon. Siguro kung wala yung Simply Nature, siguro yung tumor na nakita po sa akin, I think siguro po mas lalala po siya. Kasi yun nga po ang sabi nila, kapag na-stress yung pasyente, mas lalo po yung nagtitrigger yung cancer po. Kaya yun nga po, maraming salamat po talaga sa Simply Nature. Kasi kung hindi po dahil sa inyo, siguro hanggang ngayon stop pa rin po ako sa pag-aaral. Ngayon po, gusto ko lamang po pala ipaabot ang aking pasasalamat kila Doc Jansen and Mr. Shyan. Maraming salamat po talaga kasi alam ko po talaga nakatulong po siya sa akin at alam ko pong mas lumakas po ako. And sabi nga po ni Doc Jansen na kahit slowly siya, sure naman po talaga na gagaling po ako. Kaya maraming salamat po sa walang sawang pag-support po sa akin.
There's a miracle in this Simply Nature.
Marami po akong natutunan dito sa seminar na ito.
I would recommend it to people who have illnesses, even cancer.
We're always with you from start to healing.
Hi, this is Shan, and I'm here to update you with a quick teaser. October 14th of 2023, we had our very first post-pandemic face-to-face conference on cancer, and it was a smash hit. The participants loved the ability to ask our panelists of myself, Dr. Jansen, our expert in lifestyle medicine, and Dr. Jimmy Katapia, who's our oncological surgeon. They were able to get all the answers they wanted about cancer and whether or not to go for surgery. So we are planning in 2024 another session by popular demand because everyone wanted us to have another one so that they can bring their friends. So a quick teaser, we're gonna have back Dr. Jansen, Dr. Jimmy Katapia, so all of you with questions on chemotherapy, on surgery, the doctors and the panelists are there to answer your question. And we have an upcoming special guest. We are hoping to get someone who is going to be an expert on diagnosis, something as very interesting like liquid biopsy, all right? So that's something new and on the cutting edge of cancer diagnostics. So those of you who could not make it for our face-to-face, well, this time round in 2024 on March 16th, we're gonna do ours with a Zoom option. So those of you who are in the province who can't join us here in Metro Manila, look out for the details so that you can join us on the Zoomcast.
We are live. Good evening, everyone. My name is Jansen Lim, a board-certified pharmacist and your health advisor here in Simply Nature. Welcome to another episode powered by SMG or Simply Healed Medical Group. Last week, Thursday, February 15, we embraced a heart-healthy lifestyle. Moving on tonight, we are going to discuss the right actions to take to manage and overcome the pain of bone cancer and metastasis. Bone cancer can begin in any bone in the body, but it most commonly affects the pelvis or the long bones in the arms and legs. Actually, bone cancer is rare, making up less than 1% of all cancers. In fact, non-cancerous bone tumors are much more common than cancerous ones. However, 27% of malignant cancers can metastasize to the bones. And to give more insights, we have a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPAR's expert, Mr. Shyan Lim. We also have Dr. Jansen Kalalan, who graduated from St. Luke's Medical Center, College of Medicine, then was conferred as a diplomat of not only the Philippine College, but also the International Board of Lifestyle Medicine. He is also the medical director of SMG or Simply Healed Medical Group and a consultant at Alta Integrative Medicine Wellness Complex at Perpetual Health Medical Center, Las Piñas. Let's all watch this.
Hi everybody, welcome to another episode of Simply Healed. We are back on our cancer series and today we have a very interesting topic which is bone cancer. So let's welcome Dr. Jansen with us again.
Yeah, hello everyone. Hello Shan. Glad to be here again. Yeah, our topic for tonight is going to be very interesting. So we're going to be talking about bone cancer and the different types of bone cancers, no, and what you can do about it. Yeah.
And for any cancer patient, bone cancer is still an important topic because there are two types of bone cancer, right? Primary and secondary. So can you share with us what's the difference? And for all the cancer patients out there, even if you don't have bone cancer, but you have another type of cancer, you'll be very interested to know about secondary bone cancer, which is actually your cancer metastasized to the bones.
Yeah, correct. So that's a secondary bone cancer. Let's say for example, you have breast cancer, it metastasizes to the bone, then you have secondary bone cancer. Imagine a piece of the breast cancer tumor, a piece of that went to the bones and stuck to that. So that is secondary bone cancer. So it's metastasis, bone metastasis in other words.
So that means for example, if chemotherapy drugs are being used or immunotherapy drugs are being used, so they won't use a bone cancer drug for a breast cancer metastasized to the bone. They will actually still use
the chemotherapy appropriate for the primary tumor,
which is the breast cancer.
Yeah.
Oh, wow.
Okay, so there are a lot of different types of cancers that metastasize to the bone. One of them is breast, the other one prostate. There are many more. Okay, but that is what secondary bone cancer is. Now we have the primary. Okay, so let's focus on the primary first. Okay,
what's primary bone cancer?
So primary bone cancer is where the bones itself develop cancer. Okay, so it's your bone tissue forming a tumor. Okay, so that's different.
So it will be hard. Most of the time, it'll be hard.
Yeah,
okay.
it's going to look like a callus.
Okay.
Yeah. Okay. So more often than not, primary bone cancers they usually prefer younger age groups.
Now, okay. So younger people.
Yeah, young people.
How young?
Kids.
How young is it?
From 10 years old. Actually,
really 10
years old. As early as 10 years old, you can already develop primary bone cancer. Now there are many types of primary bone cancers, but I'm going to be focusing on osteosarcoma because osteosarcoma is the most common primary bone cancer. Okay, and like what I said earlier, the age group where we can find this the most is from 10 to 30 years old. Okay, so more preferentially in the younger age group, and usually it's males.
So has it got to do with our testosterone? I mean, is it males grow heavier bones in general, right?
Yeah. It has something to do with the growth hormones.
Which is why bone cancer is not found in usually your spine. It's usually found
in the femur. Okay, in your thigh. Yeah, in your thigh bone.
Okay? Yeah, that's like one of the biggest bones in your body.
Yes. So it's usually found near the knees.
Near the knees?
Yeah, because that is where the growth plates are. So as a kid, of course, you are growing up so fast, right? That is where the growth plates are very active. That's why that is also the place where you can usually find osteosarcoma. Okay, of course, osteosarcoma can develop elsewhere, but it's most usually found in the lower extremities. Okay, so your femur, your tibia, the other bones, your legs. But osteosarcoma, if we are suspecting that, it's really easy to diagnose. An X-ray, a simple X-ray will be enough.
How would it look like?
Yeah, it's going to look like this. Okay, so the white part there, that is your bone. So take a look at the arrow. That is the osteosarcoma. So it's sort of like here's your bone, and around it is the tumor. So it's going to, if you open that
wrap
up,
around your bone.
It's gonna wrap around your bone. But
it's not like made from bone material. It's not like hard. It is. Because it looks
material.
porous on the X-ray. So maybe it's less dense than the bone.
Yeah. It is less dense than the bone because it's replicating faster. Okay. All right. So that's the reason why it's sort of like less dense. But if you open that up, it's going to be hard as well.
Common facts about bone cancer. Is it common? And if you do get it, what is the prognosis? I mean, how is the chance of treating bone cancer?
Okay, so bone cancer is also a sarcoma. Okay, now for sarcomas, usually the prognosis is really bad. Okay, if you don't do anything about it. Now here's the SEER category, the SEER ranking according to the 5-year, according to the SEER stage, localized, regional, and distant. Now, if it is just localized, then the 5-year prognosis is good. It's 77%. But if it spreads regional, it's going to go down to 65. And if it spreads elsewhere, distant metastasis, bone cancer metastasizing, for example, to the
liver,
to the liver or to a distant organ, then your prognosis is going to go down up to 26%.
Wow. Doc, we were having a conversation just now. So actually, bone metastasis, not your breast cancer metastasized to the bone, but bone cancer metastasizing elsewhere is actually less likely because it's harder to spread. But if it does spread, it is usually very bad.
It's usually fatal
because the bone marrow is like the super expressway to
the other parts of the body. If when that time comes, the tumor is going to be so big as well, and most of the time your body will be under so much pain already that
you will not mistaken it for anything else.
Correct. So
we know the prognosis. So what's the treatment?
now the treatment for primary bone cancer is simple: surgery.
So we cut it off.
Yeah, we cut it off, cut the limb off. That's curative. You will live a full life.
So you're like 100% cured.
Yeah.
But the thing is that you will lose the limb.
Yeah, that's the trade-off for this.
Okay.
Now, for tumors which are quite big or non-resectable tumors, so let's say for example, it grew in that part of the body where it is really very difficult to operate on.
Like your hip, for example.
Let's say for example, it metastasized to the hip bone,
Yeah.
or it metastasized to the pelvis, for example. You cannot remove your pelvis. Okay.
Wow.
So in those cases, surgery is not an option.
Then what do they do then?
Yeah. They do chemotherapy and radiation therapy. That's the usual treatment modality that your doctors will do.
You know, when I think about normal types of cancer, natural therapy comes to mind. But when I think of the bone, it seems like a hard thing. Is there like dietary things that you can do to help bone cancer?
Okay.
Is it the same? I mean, is it the same?
In terms of concept, it can be the same. Because the plant-based diet is the only diet that has been shown to have reversed certain types of cancer, like prostate cancer, breast cancer, colon cancer. But of course, bone cancer is a different type of cancer. It's a sarcoma, right?
It's a sarcoma.
So with that, you're going to it's also very rare as well. So there's not much study about it.
Okay.
Especially when it comes to dietary choices or dietary impacts.
Yeah, because not enough bone cancer patients to experiment.
Not enough sample. Yeah, number one, not enough sample, and number two, if you have this type of cancer, it's going to be removed. Number one, it's going to remove, or if it stays there, you don't get to live a very long life anyway because of the prognosis, right?
Wow.
So it's really very difficult to say that okay, this type of diet is going to help it. It's going to help reverse it. But the only thing that we can do probably is to reduce the inflammation behind it.
So your lifestyle choices, can still slow the cancer down, make your body a hostile environment for the cancer to develop.
And that's where prayers come in. I mean,
that's where we.
That's
where even doctors know their limitations.
Yeah,
right?
That's where prayers come in, and hope everything goes okay. Yeah, so. Because of the rarity, the severity of this type of cancer, there isn't really much treatment options available.
So it's basically surgery, chemo, and radiation therapy.
So with this type of cancer, it's really very important to catch it early and then have it removed early.
Right, because removing it is a 100% curative action.
Now let's go to the secondary bone cancer, which is metastasis. Now, bone cancer or metastatic bone cancer accounts for 5% of patients with metastatic cancer.
So if out of 100 cancer patients where their cancer spread, 5 of them will spread to the bone.
Okay. Now, this can vary widely depending on cancer type as well. Okay, so as I mentioned a while ago, depending on where your cancer or where the primary tumor is located, it can preferentially metastasize to the bone or not. Okay. So here's another one. More common organs that metastasize to the bone is prostate and breast cancer. Okay, so
we hear many patients with breast cancer metastasize
to the bone. Usually, for breast cancer patients, it metastasizes to the brain, bone, lungs. Those
brain,
organs.
bone, lungs. We need to cover brain, doc, because I'm also curious. Obviously, we don't do much surgery for brain tumors, and chemo for the brain seems like it's gonna fry the whole brain. So it seems like radiation is the preferred for brain.
We'll have that for
another
episode.
Interesting, right, guys? Yeah. All right.
Okay. Now,
and then it's important to all breast cancer patients because if the metastasis comes, it goes commonly to your lung, bones, and brain. So tonight's topic is really good because breast cancer is so common among our viewers.
Yes. Okay. So. Again, with 70% of people with advanced prostate or breast cancer have bone metastasis. Okay, so it's a big
chunk.
Yeah, big chunk. No, so if you have stage 4 prostate cancer, stage 4 breast cancer, more often than not, you will have bone metastasis. All
Doc, of all the patients that I've encountered with bone cancer, most of them are actually all of them are secondary. They always complain about pain. So bone cancer and metastasized bone cancer is more painful in general to other cancers?
Yeah, because the bones is actually it has a lot of nerves. It's very vascular, no? Contrary to popular belief.
Yeah, it's not just a dense thing that you can hammer people on.
It's not like a wood, no? Inside the bones is actually penetrated by a lot of blood vessels.
And how serious that is.
Yeah. If you develop bone metastasis, usually patients survive around 6 to 48 months. So it's quite a long
quite a variation.
Quite a variation, right? But depending on how frail you are, depending on how strong you are, when the cancer metastasizes to the bone, it's going to be in this range. Yeah.
So now, the all-important thing, Doc, when we find out that we have bone cancer, be it primary or secondary, what can we do?
Yeah. Okay. So if you are suspecting bone cancer, so the first thing the first complaint that you will feel is of course pain. No. Now, if you feel pain, we have to distinguish that between a simple arthritis and an actual bone metastasis. Now, in the setting of if you're a cancer patient, no, and you feel pain, the first thing that your onco must rule out or your doctor must rule out is bone metastasis. Okay. Now, the number one diagnostic test that you should undergo is a bone scan, a total body bone scan. Okay. Now, once you have underwent that bone scan, there are certain patterns that the doctor will be able to see in order to distinguish metastasis to the bone or a simple arthritis. Okay. Now, in this picture, this is what bone metastasis look like. Okay. So bone metastasis more often than not prefers the ribs, the spine, hips. Okay, the skull as well, even the collarbones. Okay, so in the central skeletal system. Okay, so that is where bone metastasis usually prefers to operate. Okay, now once you have this diagnosis, okay, we know that you have bone metastasis. Then next one is the other treatment options like nutrition therapy, chemotherapy, hormone therapy, immunotherapy, and of course you need to be on pain medication already. Okay, so those are the treatment modalities that you can have.
Doc, since primary bone cancer is usually treated with surgery, I mean we remove the limb. So really treatment variation comes in the secondary bone cancer. So am I right to say that whatever worked for, like, for example, breast cancer would actually work for breast cancer metastasized?
Yes.
All right. Yes. So does that mean that our PPARS protocol would then work for a patient with, let's say, breast cancer metastasized to the bone?
Yeah, of course. It will still work that way. I'll give you another example.
We have a patient.
Yeah, we have. I had a patient. This patient of mine has stage 4. Breast cancer already, metastasized to the bone. But after taking PPARS, after undergoing chemotherapy, now there were some tumors in the bones that shrank.
Oh, shrank?
Yeah. Some were gone, but some were still there, but not growing. Yeah. So by doing this procedure, we stopped the spread of cancer. But it's still there, and of course, at the back of our mind, that bone metastasis might still spread more. So it's really very important to
continue the protocol.
Continue the protocol, finish the protocol, and manage the risk factors.
But what was some of the results that your patient saw? Was she actually in pain because metastasized to the bone? How did your protocols help her?
Okay, quite interesting because this patient of mine, after being bedridden for a very long time, this patient of mine actually was able to go shopping in the midst of the pandemic. So I was actually more scared for her getting COVID than getting the rather than her cancer spread. Yeah.
So it's great. You actually had success with treating cancer, managing cancer that has metastasized to the bones.
Yeah.
So for anyone out there, if you have that concern, just arrange for a consult with Dr. Jansen. He specializes in managing patients with cancers. All right. So Doc, any other things that you want to share with us about bone cancer before we go to everyone's favorite segment, which is the Ask Me Anything? And I'm sure that you'll be excited. I mean, some have already sent. Some people send their prognosis, the diagnostics to our healthcare specialists. Many viewers do that and then ask us to explain, or ask Dr. Jansen to explain what it means. So we are always happy here to be able to answer your questions. But Doc, any last words about bone cancer?
Bone cancer is one of the more common reasons why people die from cancer. No, so please, if you have bone metastasis already or you are suspecting bone metastasis, please go for a consult so we can help you manage it. Okay, so please don't delay, because if you delay further, then more and more parts of your skeletal system will be affected, and then it's going to be very painful and you're not going to have a good quality of life. Okay, so please go for a consult. Okay?
And before we go into AMA, I always want to remind, just go and look at our past series. Dr. Jansen is always very positive about the success of treating cancer and managing cancer and totally defeating cancer. So the key thing that he always advises, he just had, is don't delay. Time is your friend, but it's also your enemy in cancer. If you act early, it is your friend. It's going to increase your success rate. If you delay or ignore, just don't want to face reality for a while, don't do that, right? Just act. Our team here is very encouraging, and they've dealt with all sorts of cases, difficult ones, simple ones, and they are equipped to encourage you and hold your hand so that you can quickly go to the next step and get this cancer beaten. All right, so let's go to our Ask Me Anything segment.
Questions are very much welcome. Just type them down in the comment section below. Kahit Tagalog, okay lang po. But just before we go to our AMA or Ask Me Anything portion, quickly, I just want to greet our avid viewers, Ms. Cheryl Rubio, Joy Cabrera, and Helen Kamonayan. Webinar is not the same without you. I would also like to greet our new viewers, Yam from Pasig, Melissa Andresio, and Susan Osorno from Rizal Medical Center. Welcome to the program and salute to all healthcare providers. Now, to answer your questions in this modern world filled with noise of different health opinions, trust the ones from the experts. We are sorry that Sir Shyan couldn't join tonight because he's currently in Taiwan, where we cultivate our unique strain of microalgae for PPARs. So let me call in Dr. Jansen Calalan. Good evening, Doc.
Yeah. Hello, Jen. Can everybody see me? Ayun, okay. Hello, Jen. Hello, everyone. Good evening, and happy to be here.
Yun. I can see a lot of questions coming up and shown privately. So let us start the live AMA or Ask Me Anything portion. First question coming from Miss Ayla Arjona. How many percentage rate for a successful bone cancer treatment?
Okay. Treating bone cancer is very, very difficult. So in general, if you want to have a very good survival rate, then surgery is really the way to go. But if you undergo surgery, most of the time, if caught early, survival rate is really very high. Okay, at least 90%. Okay. However, if the cancer was caught at a later stage already, and the surgeons typically advise you, all right, you're in the later stage, there are metastases already, then survival rate is really very low. Okay. Typically, survival rate for this kind of cancer, okay, especially bone cancer, which is a sarcoma, is usually up to 20%. Okay, so meaning they people, okay, 20 out of 100 people who has this, live beyond 5 years. Okay, this is what the survival rate means. Okay, it's the survival rate, the percentages that I mentioned cannot be individualized. Okay, because each patient undergoes different treatments. They have different health profiles, different age, different genetics, different environment in which they live. Okay, so when we're talking about percentages, always take note that this is a number. that represents, no, X number of people out of 100, 1,000 will still live or die after 5 years. Okay, this is what it means. Okay.
Yeah, I guess that also answers the question of Miss Cheryl Rubio, which is what is the lifespan of a cancer patient? That's very broad, no? So, ma'am, please let us know what type and stage of cancer you're
Yes,
suffering
yes,
from.
yes. What type, what stage, how old? But it's very difficult to answer, really. Very, very difficult. Because again, each patient is unique. How unique would be patients are, the diet is unique, different. You have unique genetics. The environment in which you live in is also unique. The treatment that you will undergo is also can also be unique. No, sometimes most of the time, cancer treatment is individualized. So this gives a variation in terms of lifespan. Okay, so we cannot really say or tell you a specific number for this. Okay.
Yes, thank you, Doc. Next question from Alma Casimiro. Why is it that even if you take pain reliever, the pain is still consistent?
Yeah, so for pain management in cancer care, no, you have to identify what type of pain is it? Is it pain coming from inflammation? Is it pain coming from the nerves getting damaged or the nerves getting compressed? Is there any obstruction that causes the pain? So, or is there any pressure that causes the pain? Okay, so these things, no? So it's best to see your doctor so to identify what kind of pain reliever would be best for you. Okay, and most of the time, no, for cancer, pain management is again a very difficult thing to manage and treat. It can be quite challenging for both, of course, the patient and the healthcare provider. So these information have to be, you have to observe. Okay, these symptoms, where is it located? Where is the pain? Is it radiating? Where is it starting from? Where does it go to? Is the pain, a sharp pain? Is it heavy pain? Burning? These characters, no? You have to tell your healthcare provider these characters of the pain. So the healthcare provider would know which kind of pain reliever to prescribe you with. Okay, so but in general, for cancer patients should have an anti-inflammatory medication. Um, yeah, one way or another. And for those cancer patients who have, severe pain, then opioids can be used. If you experience plenty of side effects from opioids, then of course you cannot prescribe that, you cannot take that. Sometimes you can go for pregabalin for neuropathic pain. And there's one um, supplement for pain, no, that I just learned from the conference, from the Integrative Medicine conference today, which is arginine. Okay, the brand name is Agmaset. So that supplement actually works wonders for pain management. Okay, so yeah, so very important, don't just self-medicate. Okay, you have to go see your doctor, because if you self-medicate as well, you might take the wrong pain reliever, which might cause more harm than good. Okay, so yeah.
Yeah. So for those of you who wish to have a consult with Doc Jansen Kalalan, the link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist Beth will reach out to you shortly. Next question coming from Janice Busil. What are the possible rehabilitation programs for bone cancer patients?
Well, I'm not a rehab medicine doctor, so of course, physical therapy would be very important here. So you must go see your rehabilitation medicine doctor, especially if you are going to have a prosthesis on after surgery. Okay, so when we're talking about surgery for bone cancer, no, that is amputation, that is limb amputation most of the time. Okay, I can say that it's at least 95% of the time. The 5%, I don't know if there are new modalities that you can take a portion of the tumor only, a portion of the bones, but more often than not for bone cancer, it's complete limb amputation, no? And for complete limb amputation, of course, you would have to have a prosthesis on so you can still function independently, okay? So if you're going to have a prosthesis on, then you have to practice to be on it, practice how to use it. It's best to have to be guided by the proper healthcare providers, which would be your rehabilitation medicine physician and your physical therapist.
Okay. Next question from Fatima Bokalid. What is the early test or detection for bone cancer? Because my mother has bone cancer and died of complications. At my age of 48, is it advisable for me to have a test?
Yes, bone cancer typically can run in the family. Typically, it can be from the genetics, no? So definitely, yes, you have to get screened. What kind of screening tests can you undergo? Now, to diagnose bone cancer, you only need chest X. It can be diagnosed through an X-ray, okay? Just to see more or less this tumor growing from the bones. Is it is the character more on malignant or benign? Okay, so these things. To screen, you can undergo X-rays. However, to diagnose, a biopsy must be performed. Okay, a biopsy must be performed to diagnose, to know for sure if it's bone cancer or not. But an X-ray would give a physician more or less an idea if it's malignant or not. Okay. Now, if on X-rays, okay, if you get diagnosed with bone cancer on X-ray, no, before, even years before the X-ray, it's already there, beginning to grow. The thing is, how can you detect it when it's not yet detectable on an X-ray? Okay, what you can do is to perform or undergo a liquid biopsy to test circulating tumor DNA. Okay, what's circulating tumor DNA? So it's from the name, no? Circulating means it's circulating around your body, inside your blood. Okay? Tumor is, of course, the cancer. DNA is basically our genetic makeup, no? So this test, no, testing for circulating tumor DNA is just getting 10 ml of your blood. So that's basically liquid biopsy. And the machine, no, detects whatever circulating tumor DNAs that can be found inside your blood that can be used as a screening tool. Okay, I just don't know if they are able to screen for bone cancer already nowadays, no? Because so far what they can screen for are the more common ones, which is and most of them are sarcomas. Okay, so you can screen for colorectal, ovarian, endometrial, lung, stomach, liver, breast. Yeah. Yeah, those eight, as far as I know. Okay. Yeah, for bone, especially for sarcomas, as far as I know, they cannot test yet for that, but they can test your genes if you're predisposed to develop this. Okay, so it would be advisable for you to undergo this kind of test. No? Again, it's a liquid biopsy. Okay, to test for circulating tumor DNA.
Wow, that's very innovative. Okay, let's move on to the next question from a Facebook comment from Donna Maneklang. I am triple negative breast cancer patient. I was told that I only have one treatment option, which is adjuvant chemotherapy. I will be undergoing treatment on Monday. What preparation should I do? Thank you, Dr. Jansen.
Okay. A number of things that you can do. Very important. Number one, you have to begin exercising, and by exercise, it's just light to moderate intensity exercise. Do it 30 minutes every day. So it's for cancer patients, it's very important to make sure that your cardiorespiratory fitness is really well. It's really good. This is basically to combat fatigue after chemotherapy. After chemotherapy, it's for sure that you will feel fatigue, no? You will feel its side effects. And with exercise, if you're regularly exercising, no, you'd be able to tolerate the fatigue better. Okay. Another one is to begin eating the right foods, eat properly. For cancer patients undergoing chemotherapy, typically they lose weight, they lose a lot of muscle mass as well, no? One way to mitigate this is to make sure that you're eating a high protein diet. Okay? But make sure that it is plant-based. Okay? Because animal food products can make tumors grow. All right? However, again, you need the high protein diet. So where do you get your protein? You have to get them from legumes, from nuts, from seeds, and whole grains. Okay? But remember, your beans, you should soak them overnight. Okay? Throw away the water, then you can cook the beans already. Okay? For nuts, again, it's better if you soak them. Okay? Before you eat. Okay, so that is one way for you to help increase your protein intake. Okay, another one would be to take supplements. Okay, so which supplements do I love for in preparing patients for chemotherapy? There are a few products that I use. Number one would be, of course, Simply Nature PPARs, which is the sponsor of this program. Another one would be for Simply Nature PPARs, there are a few products that you can go for. You can go for the liquid, you can go for the powder, or the tablets. Always have the tablets because their tablets is really good for nutrition and it has resveratrol. Okay, resveratrol mimics fasting, which works really wonderful for cancer because if you starve cancer cells, then they die. Okay, resveratrol again mimics the effects of fasting. Okay, how it's to reduce insulin resistance, no? But this is for another topic already. Okay, so moving on to the next supplement, I also use lentin, which is bio bran. Okay, it's made from rice bran. Okay, it's just as in sachet form, and you dissolve that in a glass of water. Okay, another one would be curcumin. Where do you get curcumin naturally? It's from turmeric. So turmeric, it's best to be eaten, okay, mixed with your food. Okay, but if you don't like the taste of curcumin, then you can go for the capsules. Okay, but for curcumin, it should be mixed together with ground black pepper to increase its absorption. Okay. Another supplement that I really love would be EGCG. EGCG is from green tea. Okay, so if you want to have a supplement, no, EGCG is there are a lot of EGCG products out there. You can buy them from Healthy Options, Lazada, Shopee. You can buy from there. But however, if you don't want to spend too much on these supplements, then you can go for green tea or matcha. Okay. What else? You can also go for broccoli. Broccoli should always be present in your diet. Very important, no? Sulforaphane, because sulforaphane is a very good anti-cancer molecule, which is uniquely found in broccoli, cauliflower, and cabbage. Okay. What else? What supplements? Okay, these are more of a not really supplements, no, but these are modalities already that we can do. One is vitamin C drip, can help minimize the effects of chemotherapy. So it's a drip, okay? It's a drip, meaning we give IV vitamin C, intravenous, okay? Another one would be hyperbaric oxygen. Hyperbaric oxygen is giving oxygen in high pressure, and medical grade oxygen, 100% oxygen. Okay? So that can also help you recover from the ill effects of chemotherapy. Okay. What else? Ozone therapy is also a very good modality to help your body repair. To help increase. By the way, there are vitamin C works in synergy with a few chemotherapy drugs, no, like cisplatin. There are a lot, no. I have this list. I don't remember them all, but cisplatin is one of them. 5-fluorouracil is also one of them. In which vitamin C works in synergy. What else? Yeah, those are some of them. No, there are still plenty, but those are some of them. And by the way, if you are going to undergo anything with radiation, okay, especially for diagnostic purposes, okay, so again, this is only for diagnostic purposes. So before you undergo CT scan, PET scan, or anything, any procedure, X-ray, no, any procedure that involves exposing yourself to low dose radiation, astaxanthin is a very good supplement to take before you undergo the procedure. PPARs can also be a very good supplement to take before these procedures. No, it can help. These can help protect your body from the effects of radiation. Yeah, there are still a lot. There's still a lot. No, but I'll end it here because we have to move on to the next question. Okay, so those are some things that you can go for.
Thank you, Doc. Wow, that's a lot. Hope you guys take note of all of that. But don't worry, you can always replay and share with your family and friends our very informational weekly webinars and very inspirational success stories. Just subscribe to our YouTube channel. Search niyo po Simply Nature International. Yan. Okay, next question coming from Miss Nemia Tomasis. I have invasive carcinoma stage 3. Paano ako maka-order ng PPARS powder? I think I should answer this one, though. Okay, so make sure you get our authentic, safe, and effective PPARS on our official Lazada Mall and Shopee store and our direct from BGC Taguig office. Ayan. I guess that also answers the question of Miss Susan Lamiel Lopez. How much is PPARS? Chat our client service officer po. So, we can tailor the personalized dosage form for you. And then, another one from Noel Eleptico and Kitty Cruz. How much PPAR again? Okay, just comment lang po your health concern. So, our client service officer will attend to you. Ayan. Next question coming from Miss Lalaine Felicitas. Medyo mahaba rin to, Doc. Children with brittle bones due to RTA also exhibits rickets. Though they are on meds for their acidosis, their heart and bones would PPARS help. Even though they have this condition, it seems they are like cancer patients with pain seizure episodes and muscle weakness episodes, thereby affecting their growth and development. So which of your products would kickstart their condition?
I would start first on the tablets. Okay, because the tablets for these conditions, no, there would be a degree of inflammation going on. Okay, because remember the patient has rickets. So rickets is a consequence of vitamin D deficiency. If you're deficient with vitamin D, it's not just the bones that gets affected. It's also your immune system. It's also the way your body generates antioxidants. So if this is the case of the patient, then there would be some ongoing inflammation that would be present inside the body as well. PPARS has very good antioxidant properties. Okay, so you can start with the tablets, but don't end there. I would highly recommend vitamin D therapy. Okay, so the way you do this for the patient is you have to test for serum vitamin D3 levels. You have to test for PTH. You have to test for ionized calcium. It would be best if you get a doctor to help you monitor this. But yeah, I would highly recommend for you to get a doctor. But one way for you to do this is to check for the serum vitamin D levels, check for PTH. PTH is parathyroid hormones, and lastly, serum ionized calcium. Then you give the patient vitamin D3. Okay? Upon giving the patient vitamin D3, you want the vitamin D level of the blood to be near the upper limit. However, the PTH should go down just above the lower limit of the normal. Okay? However, okay, here's the thing. There might be some toxicities that might happen, no? Say for example, high calcium levels, no, or low or very low calcium levels in the blood. So these can cause the toxicities of vitamin D. It's the calcium. So you have to monitor the ionized calcium. It should not go up too high. It should not go below the normal. Okay, because this is when you develop symptoms. Okay, and So that's for vitamin D. And lastly, you have to make sure that calcium goes into the bones. So you don't stop at vitamin D. You have to have vitamin K2 for the calcium to go inside the bone. Okay, so this is mainly to manage the rickets as well, no? And of course, you mentioned that there is some acidosis that is going on, renal tubular acidosis, no? It's the disease itself. What I recommend for you to do is to make sure that the patient is on bicarbonate. Bicarbonate is to help alkalinize, to neutralize the acidity. PPARs is a supplement that can help alkalinize as well. But don't just rely on PPARs to alkalinize the blood. No, you have to have the bicarbonate still. Okay? And hopefully, no, with PPARs, the bicarbonate requirement would go down. Okay?
Thank you, Doc. That's very complicated pala. So make sure, guys, you are managed by your multidisciplinary health team. Okay, next question coming from Miss Anna Karen Elorin. Is bone cancer irreversible?
Once it's there, yeah, you cannot reverse it. Because once the bone becomes cancer, the cancer will eat away the bone. And if it does eat away the bone, then the bone will not rebuild itself back to how it was before already. Once it eats away the bone, then yeah, it's damaged forever. The deformity will not deform itself. Okay, so most often than not, this is quite painful, and when it does spread, no, it's quite fatal. So it's really very important once you do develop bone cancer, very important to take it out.
Is it the same case, Doc, with arthritis, deformities?
No, it's very different. Okay, the deformities resulting from arthritis can be from two things. One is if it's autoimmune, like for example, rheumatoid arthritis, psoriatic arthritis. On some occasion, another one, it's gout, no? So these arthritis or arthroses can form deformities, can result into deformities. Okay? Osteoarthritis is a different disease entity. Osteoarthritis, although it can cause deformities, the immune system is not the one that causes the deformity. It's because of the body weight. Okay, it's because of physical factors that causes the deformity. Okay, and of course the inflammation itself. Okay, so yeah, definitely no arthritis from other diseases, especially autoimmune, can lead to deformities. No? Yeah.
Thank you, Doc. Okay, next question coming from Miss Yam. What are the main cause of bone cancer?
Again, it's mainly genetic. Exposure to prior radiation when you were younger can also be one factor, but mostly it's genetics.
Oh, follow-up question. And how does bone cancer spread?
It spreads through your blood. Yeah, it spreads through your blood. That's why I mentioned a while ago, if you want to screen for this, no, or any other, or to screen for any other cancers, while imaging modalities are quite valuable in early detection, they can detect diseases really very early on in their disease stage, no. However, if there are cancers that can start to grow, however, they're not detectable by our imaging tests yet. Okay, there are those kinds of cancer begins that way really. Okay, that's why you screen regularly. Okay. However, if you want to catch cancers that are growing or circulating around your body, that very early on, even before these imaging studies, imaging tests can detect them, then you have to go for circulating tumor DNA. If you test negative for this, then it's for sure that you don't have cancer. Yeah. But if you do test positive, then you have to chase this. Okay, you have to know where it is coming from, what kind. Okay, yeah. So that's how you go about things. Okay, when you're using this circulating tumor DNA test. Again, it's a liquid biopsy. Okay.
Thank you, Doc. Next question coming from Joseph Albert Gajo. Best ways to achieve zero pain management.
Zero pain management is it's to use general anesthesia. Okay, or when you're asleep, okay, or sedate you. Okay. In cancer, pain is a very, very difficult thing to manage. Really, I have to be honest here. Sometimes, physicians get depleted of our resources, or yeah, no, when we're managing pain, because sometimes we max out our our modalities already, and yet still the patient is experiencing pain. So to really have a good pain management, you have to make sure that you, number one, make sure the cancer does not spread. How do you do that? It's through, of course, early detection of cancer, so you get treated early. And beyond that, no, even before that, make sure your risk factors for cancer development are addressed. So the risk factors would, of course, be coming from your genetics and the environment in which you live. No, for genetics, there's nothing really you can do much about it, but hey, we can turn genes on and off depending on how we live our lifestyles. And for lifestyles, no, for that matter, make sure you watch what you're eating. Make sure it is a high fiber, low sugar, low fat diet. Okay. Make sure you're exercising, you're sleeping well, and most importantly of all, you're emotionally well. You have a very positive outlook in life. So these things, no, this is where you really win against the battle in cancer. But for pain, when you're already in pain, it's very difficult. Okay. More often than not, we do trial and error. Okay, I have to be honest here, no. More often than not, it's a trial and error. So we try this medication for you. If it works, then good. If it's not, we change them, or we increase the dose. Yeah. We do it this way. Okay.
Okay, thank you, Doc. Next question is more specific from Gemma Guillermo Libuna. How to manage back pain, especially the upper and lower back pain, without taking any painkillers?
Okay, again, you have to know what kind of pain. Where is it coming from? Is it muscle pain? Is it bone pain? In what setting is it occurring? Or in what background is it occurring? Do you have underlying diseases? These things have to be addressed. Okay, these things have to be assessed by your doctor. You have to get treated. Okay, so if you're experiencing back pain because of poor posture, then you have to correct your posture. Why do you have a poor posture in the first place? Maybe your workplace is not ergonomic. Okay, so probably your monitor is too high, too low. Your table is too high, too low. Okay, so these things. Okay, these things have to be addressed. But since our topic is bone cancer, no, if it's bone cancer, okay, you're experiencing pain from bone cancer itself, then we start from the simpler pain relievers. Then if it doesn't work already, we go up, we intensify your pain relievers, we mix them, okay, until such time that your pain goes down or it disappears. And hopefully it disappears. Okay, so that's how we can do it. Okay.
Yeah. Thank you, Doc. Next question from Facebook comment. Stragoy. Okay. Pwede ba mag-take ng PPARs kahit hindi na magpa-treatment?
Depends. Again, what is your goal? Are you aiming for cure or are you aiming for quality of life? Okay. For very advanced cancer, wherein the patient is already very weak, obviously the patient is already towards the end of his journey here on Earth, then probably it would be best to aim for quality of life. So This is palliative care. We make sure that the patient is at his or her most comfortable. Okay, that's what we aim for. Then PPARs alone can do this. At least try to make the patient a little bit more comfortable. More often than not, they have very high inflammation, very high inflammatory markers. PPARs can help lower this down because again, PPARs has very good anti-inflammatory, antioxidant characteristics. If you are aiming for cure, there's no one cure for cancer. I hope I can, say that if you take this, your cancer will disappear, but unfortunately, we don't have that yet. Okay? Cancer treatment or curative treatment for cancer is multimodality. The modality that best increases your survival rate is surgery. If you take out the cancer, then your survival rate goes high. It really jumps up because you immediately cut the tumor burden away from you. Cut down the tumor burden. You have to only only worry about the circulating cancer cells already or the micrometastases. Okay, but that's what it is. That's how it is. Okay. So unfortunately we're still not there yet, but hopefully, someday some guy, very smart guy, can develop a cure, a true cure for cancer. But right now we're still not there yet. Okay?
Okay, more questions from Facebook. From Alma Aligada. Hello, Doc. May adenocarcinoma po ako, grade 3. Pero hindi ako nagpa-opera. Nag-herbal lang ako. Mga 1 year na ata ako nagtitreat. Nakailang CA125 na din po ako at 4.5 po yung result. Pero, nag-bleeding pa din po ako. Ano po ang pwede kong gawin?
Yeah, the bleed, I have to know what kind of cancer did the patient did she mention any what kind adenocarcinoma? Yeah, adenocarcinoma is a type of cancer that can be found in different places of the body. So I have to know where it's located, okay, where the cancer is located. But if you are mentioning that you're bleeding, then the cancer is still there, okay? So I mean, you should not be bleeding, okay? And tumor markers, don't use them for screening, don't use them for diagnosis, only use them to check response to treatment. However, you should not be following it, religiously or 100% because tumor markers like CA125, the CA, AFP they are not very good. They are not very good markers to know what your status or your prognosis. Okay, it's only one tool to monitor treatment response. Okay, it cannot tell you if there are still cancer present. It cannot tell you your prognosis. If this is high, then you're likely to be worse. It cannot also tell you if will the cancer be coming back. Okay, yeah. So it's very non-specific as well. There are a lot of cancers that can increase these tumor markers. So I think it's ovarian, no? Yeah. So if it's ovarian, then they're still bleeding, then the cancer is still there. Okay, you have to follow up with your doctor, with your onco, to see what we can do. Okay, I think it will also be best if you go for a consult, schedule a consult, no? So we can look into our options. Okay.
Okay. Next question from Facebook again, Mar Elishkiel. Doc, pwede po ang PPARs for hormonal imbalance? Thanks po.
Oh, yes. Okay, here's the thing, no? For hormonal imbalance, you have to treat the underlying cause, no? So, of course, you would have to have hormonal treatment. Okay? However, the effects of hormonal imbalance will lead to, a lot of inflammation, insulin resistance, these things, no? PPARs can help with those consequences. So, it's like this, no? At the center, the hormonal imbalance, okay? At the center is the hormonal imbalance. You have to correct that through your bioidentical hormone treatment. Okay? So of course, as a consequence of your hormonal imbalance, you have all of these effects on the side. Okay, so one of these would be your inflammation, insulin resistance, etc. So PPARs would help address these peripheral or subsequent effects of hormonal imbalance. Okay, but again, to correct it, definitely you have to correct the hormonal imbalance in the first place. Okay, and for PCOS, PCOS has insulin resistance ongoing as well. No, that's why your OB prescribes you with metformin. PPARs can help in decreasing the requirement of metformin to lower insulin resistance or to lower your diabetes, okay, so to speak. All right, so yeah, that's how that's one way how PPARs can help.
Thank you, Doc. Okay. He has a follow-up question. Thanks po, Doc. Okay lang po ba, Doc, mag-take ng PPARs sabay ng hormonal pill? Thanks po ulit.
Oh, yes, yes. It doesn't have any interactions naman. One does not decrease or enhance the effect of another. So they're fine to be taken together.
Ayun. We're almost at the end of the webinar. I think this will be our last question for tonight. From Delhi River, paano pag-inom ng PPARs for prevention?
For prevention, tablets would suffice. So 20 microtablets once a day, you chew that. Best taken on an empty stomach. Also, make sure that you're not taking any antacids together with it, okay? Because antacids, I just learned this, new principle. I think I haven't shared this with you yet, but if you're taking antacids, make sure you don't take them together with your PPARs to enhance the absorption of PPARs. Okay, that's basically the purpose because you need the stomach acids. Okay, so that's why I also advise you to chew the PPARs to get better absorption. But if you hate the taste, you just hate the taste. Okay, some things that you can do with it is to mix it with your smoothies. You can also, just try to swallow it whole. Just make sure to take it on an empty stomach. Okay. What else? I think that's about it. Yeah.
Yeah, guys, that's why PPARs is taken 30 minutes before meals. Okay. Last question talaga,
Okay,
Doc.
all right.
From
Sige.
Stragoy. Again, Doc, ang asawa ko may cervical cancer, stage 3C. Sabi ng onko niya, mag-maintenance na daw siya ng chemo, kaso hindi na po kaya ng katawan niya ang side effect.
Yeah, ito I recommend you to go for a consult. We need to talk already para alam ko kung ano ipe-prescribe to help the body of your wife recover, no? Bakit siya nanghihina in the first place? However, para may magawa na kayo immediately after this, no? I would assume that your wife is also quite thin already kasi most cervical cancer patients at that stage, no, has some form of cachexia or muscle wasting already. Ang first advice ko is, number one, go on a vegetarian diet pero high protein dapat. High protein meaning maraming beans, nuts, and seeds. Marami talaga. If these food items can take up half of the plate, it would be best. Okay? Kailangan marami. So beans would include your chickpeas, lentils, green peas, no? Munggo, nuts, make sure 2 handful of nuts, no? Some really good nuts that you can that has very good anti-cancer properties would be walnuts, pecans, almond, peanuts. Okay? For seeds naman, ground papaya seeds. Ito ground na dikdik Ground papaya seeds, you can also go for ground flax seeds. Flax seeds, FLAX, no? Ground flax seeds. You can buy that from supermarkets, healthy option. Kung masyadong mahal doon, Lazada and Shopee is your friend. Okay? What else? Yeah, yun muna. If she can exercise, better. Kung mag-exercise siya, weight-bearing dapat. Pero kung di niya kaya, wag pipilitin. Yeah, those are some things that you can do immediately. Okay? And of course, if you want to try PPARs, you want to try it out immediately, ang marirecommend ko would be the tablets for sure. And if you can afford the liquid, then the liquid would be best. Kung hindi naman, then powder, pwede na. Then aside from that, yung ibang modalities, we have to talk it out. Okay? We have to know which will help the body of your wife, recover faster. For stage 3C cervical cancer patients, kasi most of the time, affected na rin ang bladder, affected na rin ang kidneys. Bowel movement can also be affected likewise. So we have to check these organs first, ano yung status nila, to go for further recommendation. Okay? So that's it for now.
Okay, thank you so much, Doc. It looks like we've covered all our questions. I'd just like to shout out to Ma'am Nessie Ocampo and Emily Reyes Abansano from Ma'am Sheila. Ayan. And if you have any follow-up questions, don't worry, we will answer each of your questions next webinar or via direct message. But just before we say goodbye, kindly give our viewers your parting words for tonight, Doc Jansen.
Yeah, first of all, I want to thank all of you for attending, okay, until this late at night, 8:30 p.m. na. Some of you, I think, are quite tired already. But thank you, So I think there are still a lot of questions that we haven't answered. So we're really sorry for those of you who ask questions na hindi namin masagot because our time is ending already. So next week, please do ask them again. If you really want to, talk to me, then just have a consultation scheduled. There are a lot of things that we can do for cancer patients nowadays already. So I just attended an integrative medicine workshop a while ago. Ongoing pa siya. It will be until Saturday. So for those of you who would want to schedule a consultation, please be patient, Kasi your doctor is also equipping himself, trying to learn more on how I can help you more with your condition, okay? And hopefully, the things that I learned, the new things that I learned from the workshop can be impactful to you as well. So yeah, that would be it. I'll give the floor back to Jen. Thank you, everyone.
Thank you so much, Doc. We hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. For next week, Thursday, February 29, is very special. We will discover how cancer patients can benefit from using PPARs as immunotherapy. And lastly, on March 16, Saturday, you are all invited to a hybrid health seminar entitled Innovative Modalities in Cancer Treatment, Pushing Boundaries for Better Outcomes. So calling all patients, survivors, advocates, let us all come together to explore the latest advancements in cancer treatment and engage with multidisciplinary experts dedicated to enhancing your well-being. Limited slots only, so don't miss out on this opportunity to be a part of transformative experience. Reserve your seat, bring your friends, and let's embark on a journey to a healthier, happier you. Only 150 pesos for a ticket, either on-site, face-to-face in SMX Aura, or online live via Zoom webinar. Yeah, and you can pay the registration fee via GCash and send us your details via Facebook Messenger. Thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.
There's a miracle in this Simply Nature.
Marami po akong natutunan dito sa seminar na ito.
I would recommend it to people who have illnesses, even cancer.
We are always with you from start to healing.
Hi,
Hi, this is Shyan, and I'm here to update you with a quick teaser. October 14th of 2023, we had our very first post-pandemic face-to-face conference on cancer, and it was a smash hit. The participants loved the ability to ask our panelists of myself, Dr. Jansen, our expert in lifestyle medicine, and Dr. Jimmy Katapia, who's our oncological surgeon. They were able to get all the answers they wanted about cancer and whether or not to go for surgery. So we are planning in 2024 another session by popular demand because everyone wanted us to have another one so that they can bring their friends. So a quick teaser, we're going to have back Dr. Jansen, Dr. Jimmy Katapia, so all of you with questions on chemotherapy, on surgery, the doctors and the panelists are there to answer your question. And we have an upcoming special guest. We are hoping to get someone who is going to be an expert on diagnosis, something as very interesting like liquid biopsy, all right? So that's something new and on the cutting edge of cancer diagnostics. So those of you who could not make it for our face-to-face, well, this time round in 2024 on March 16th, we're gonna do ours with a Zoom option. So those of you who are in the province who can't join us here in Metro Manila, look out for the details so that you can join us on the Zoomcast.